Type 1 diabetes can occur at any age. Typically type 1 diabetes is called juvenile diabetes because 8 out of 10 cases happen during childhood, which means in fact that about 2 out of 10 cases can have its onset in adulthood. It is very unusual to have its onset beyond the age of 40. In terms of the earliest age, there have been individuals identified with type 1 diabetes in the first few months of life, so it can happen at any age. On the other hand, there are some ages where we tend to see it more commonly, particularly around the time that children start school. So in the range of sort of 5 or 6 years of age, there's a bit of a peak, and there's a second peak around the time of puberty, so in children between the ages of about 11 and 14. But it's important as a parent to recognize it can happen at any age child. The second question that you asked was related to onset and how long it can take for the child to present. The big problem is that you're losing the ability of the beta cell, the cell that makes insulin, to make insulin. There are certain times when your body needs to make increased amounts of insulin, and a good example would be that when you're sick, even if you're eating less, your body makes more insulin because insulin has some important other actions. And so the most typical presentation of a child with type 1 diabetes will happen in the context of some sort of minor illness. So for example, a child who's got the flu, but instead of recovering, looks like they're getting worse and worse. Or a child that's had a cold, but then mom notices that they've started wetting the bed, which she may attribute to the child being just ill and not feeling well, or sleeping too hard because they're on some sort of medication. Typically, if you ask families about how long the symptoms have been going on, it typically is on the range of 7 to 14 days, so 1 to 2 weeks. If you do a little bit of probing, you often find that some minor symptoms may have been around for a longer period of time. For example, the child has been thirsty a lot more, or the parent has noted that, let's say for the last 3 months, when they went out to the mall, the child seemed to be going to the bathroom every 30 minutes, and they were always spending all their time, instead of shopping, looking where the public restroom was.